Hello, everyone, and welcome to the third and final part of our webinar series, Making an Impact, Developing and Tracking Your Community Health Strategies. My name is Zach Flores. I'm a project coordinator here at HCI, and I'll be your facilitator this afternoon. We know that we have a very limited amount of time together, and we have so much information to share with you all. So I'll get right into it with just a couple of quick housekeeping items real fast. You've all joined this event as an attendee, excuse me, so you're all automatically muted for the duration of the webinar. But if you have any questions as our presenters go through the slides, please feel free to type them into the bottom right-hand box of your WebEx window. I'll be monitoring your questions as they come in, but please make sure to select the All Panelists box when submitting them so that our presenters can see them too. And it looks like we have a good sized group with just over 70 people here today. So we're really excited to see what questions you all have for us. And in addition to our speakers, we have some fellow HCI team members who are going to be supporting the webinar as panelists today. And we're going to try to answer as many questions as we can throughout the presentation, but we'll make sure to bring up the ones that we don't during our Q&A session. And I just wanted to make one final quick note that the recording for today's webinar will be available following the end of today. So introductions, as I mentioned before, my name is Zach Flores. I'll be playing the facilitator role. And now I have the privilege of introducing our presenters for today. First off, we have Jane Chai. She's our community health subject matter expert. She has worked in community health for the past 20 years. And prior to joining the HCI team, Jane worked at the local health department in Orange County, California for 15 years. And was responsible for coordinating community health planning, strategic planning, workforce development, and quality improvement. Next, we have Ann Zwerner, who is a project manager at HCI, and she's been with us for over 7 years. During that time, she's worked with a variety of clients all across the country to build and implement their community platforms. She also works with our clients to improve their community health needs assessment processes, strategic planning, and progress tracking. We also have Ashley Wendt, who's joining us today and was a presenter for part 1 of our webinar series. Ashley is a public health consultant with HCI and brings us over 15 years of public health experience to the Conduent HCI team. And that includes domestic and international public health work. She's earned her master's of public health degree from Tulane University, and she'll be joining us for the discussion portion of this webinar later today. So we're very lucky to have Ann, Jane, and Ashley for today's webinar. And now that we've introduced ourselves, at this point, we'll be turning off our webcams in order to maximize the audio quality for the remainder of the presentation. So for those of you who may not be familiar with who we are, HCI has been a leader in the community health field for over 12 years. We've conducted over 200 community health needs assessments and implementation strategies with partners all across the country. We also provide strategic direction for community health initiatives, and we're known for our award-winning customized technology platforms. And so along with powerful analytical tools, our platforms provide access to continuously updated population health and socioeconomic data to help tell your community story. Like Jane and Ashley, HCI's employees bring both a combination of advanced public health degrees and real-life experience in community benefit and population health. I wanted to note that today is going to be the final part of our webinar series, Conducting Assessments During Uncertain Times. Part 1 of this series shared some emerging trends and best practices while completing your CHA or CHNA. Part 2 then focused on how to ensure that your assessment is a living document that engages community partners and leads to shared action. Today, we'll be discussing how to both implement as well as track your community health strategies. So with that, I'm going to pass this over to Jane to take a deeper dive into the objectives for today.
All right, thank you so much, Zach. As Zach mentioned, today we'll be building on parts 1 and 2 of our series by discussing how you can develop and track your community health strategies. We'll be covering ways to develop strategies that consider national frameworks and local data, create short and long-term performance measures to track improvement, track and share progress effectively across departments and organizations. This visualization of a community health assessment and planning cycle shows the different phases of the process, starting with planning and organizing for your efforts, then collecting and analyzing data, synthesizing data and agreeing on priorities, engaging partners and activating your plan, and finally, implementing and tracking your plan. As we're getting going, please feel free to share in chat which of these areas have been most challenging for you. So again, feel free to type that in chat, and hopefully as we move along, we can address some of those factors for you, or maybe address them in the Q&A section at the end of the presentations. In our first two webinars, we talked quite extensively about the first few phases. Today, we'll be focusing on phases 4 and 5, how to best set your implementation strategy, or IS, or Community Health Improvement Plan, your CHIP, for successful activation, implementation, and evaluation. From our experience, by the time communities get to this point, let me go back. From our experience, by the time communities get to this point, they're ecstatic to have their community health assessments completed, but also a little exhausted and unsure of how they'll gather the energy to keep going. Hopefully, today's webinar will help provide some inspiration and ideas as you move forward. We know that many of you are working to meet IRS or FAB requirements for your IS and CHIP. We're showing some of the key requirements for each. For those working to meet IRS requirements, your implementation strategy should include the actions and the anticipated impact for addressing health needs identified in your Community Health Needs Assessment, or CHNA. For each health need, there should be a description of resources the hospital is committing to and planned collaborations with other organizations. If there are needs that were identified in your CHNA that you've decided not to address, your IS should include an explanation of why the hospital facility has made that decision. For health departments working to meet accreditation requirements, your CHIP must show broad participation by community partners from various sectors. It should be clear that your CHIP considered findings from your Community Health Assessment, or CHA, including data, themes, and assets identified by the community. In addition, the CHIP will need to consider national, state, and local priorities, include measurable outcomes, necessary policy changes, and identify responsible parties for implementation. Finally, you'll need systems to review, revise, and track your plan. Let's talk about some of the ways we've worked with clients to address these requirements, starting with considering national frameworks and local data to inform your strategies. We recommend starting with a plan for evaluation in mind. We think it's important to engage your community and partners around evaluation as early on as possible to ensure buy-in of the evaluation process. As you're building your evaluation framework, consider timelines for goals, objectives, and outcomes. Determining who will be responsible for collecting and analyzing data and how you'll share results. One thing we want to caution against is parachuting in and out with our evaluation activities, collecting data from community members and partners, but not sharing back our analysis and results. Discussing your evaluation plan from the beginning is a good way to build in some accountability for yourself and your community partners. With that in mind, many communities are using a health equity lens for their community health assessment and planning process. We're showing an image adapted from the Bay Area Health Inequities Initiative, or BARHI. We think this framework gives a good visual of community-level indicators for health and social determinants of health. This framework can also help us consider types of strategies that can work to impact health and the root causes of health inequities. This is not to say that if you're interested in applying a health equity lens, you should only consider strategies that are more upstream. In fact, we know that we need both, especially at a time when many communities are in immediate need of services. So as you're applying a health equity lens, it's likely that your plan will still include individual or group level services such as healthcare or health education classes. There's also a need to consider longer-term strategies that address upstream institutional and social inequities such as racism, poverty, and disparities in education. National frameworks such as Healthy People 2030 or the National Prevention Strategy are another great resource to help inform your plan. Healthy People sets national objectives that you can consider as you're setting targets or considering strategies. Healthy People's leading health indicators can help identify high priority objectives that you might want to track over time. The HCI platform includes comparisons of local indicators to Healthy People 2030 targets to help our clients identify how their community is doing compared to those targets. If you don't have an HCI platform, you can go to the Healthy People website to look up the national targets and create a comparison for your community. Aligning your efforts with state or local initiatives is another way to build in some synergies in your plan. State health improvement plans can provide a framework showing priorities and benchmarks at the state level. While you may not adopt the state's benchmarks as your targets, they may be helpful in framing local strategies. If you're a local agency or hospital, consider how your strategies might align with the local health department community health improvement plan, which will also have some targets identified. Finally, many state or local organizations, such as a local United Way or March of Dimes, will have regional initiatives with identified goals or objectives. This can help you identify good targets or areas for shared action to build into your plan. In conducting your community health assessment, you likely reviewed how local data compared to state or national data to identify your priorities. That same information can help you set reasonable targets for your plan. This is an example of an HCI dashboard that shows values for indicators for a county compared to state and national values. If you don't have a dashboard, this information might already be in your CHI or CHNA, or can be pulled from local, state, and national data sources such as CDC, American Community Survey, or state or local health departments. Once you have that data, it can be used to inform your local targets. For instance, if addressing STDs is a priority in your plan and you know that syphilis rates are higher in your community compared to the state value, you might set your local target to match the state's current value. Many communities have overall values that look better than state or national averages, but when you look at the data by age, gender or gender identity, race, ethnicity, sexual orientation, or neighborhoods, there are areas of disparities. Understanding these disparities at the local level can help inform targets and strategies in your plan. Here you're seeing ER rates due to diabetes by race or ethnicity. As you can see, Black or African Americans and Hispanics have rates that are much higher than the county average. So even if the overall ER rates for diabetes in the county or service area is lower than the state average, it might be a good idea to work with community partners to identify appropriate targets and strategies that would address the disparities we're seeing. Understanding trends in community level data is also important to setting reasonable targets. Objectives often set targets to increase or decrease a metric to show improvement. However, if trends in your local region have been worsening at a significant rate, you might want to consider a more realistic objective to stabilize the trend or even reduce its rate of increase. We've already started talking about how to use data to inform your targets and strategies. Now let's talk a bit about targets or performance measures. Performance measures help show how we're progressing on our shared objectives. There are generally two types of performance measures that communities tend to use when tracking progress and impact. Community level indicators measure longer term outcomes for a whole community. For instance, prevalence of obesity for a zip code or a county. Program-specific indicators will measure shorter-term outputs or outcomes for a program. For instance, the number of people who completed a diabetes management class, or the percent of participants who showed increase in knowledge after participating in that class. There's often confusion or anxiety about which to track. We find that you really need to track both. Community level outcomes gives us an overall picture of what's happening in our community and whether we're getting closer to our goals and vision. Program-specific indicators give us more real-time input about actions we're taking to impact shorter-term objectives. In your planning process, you likely identified a shared vision that guides your overall efforts with your partners. To help us better see what outcomes to track, we recommend using a logic model or an evaluation plan that helps you better understand how to move from that shared vision to shared action. Based on your shared vision, most communities then decide on 3 to 5 priority areas with goals that they'll commit to working on together. Again, goals tend to be loftier, longer term, and look at community level impact. For each goal, communities typically have another 3 to 5 objectives that set targets at a shorter time frame. Many communities will also name a range of strategies to help guide the activities included in the plan. For instance, a community might indicate that they'd like to have strategies that work at the individual, organizational, community, and policy level. Finally, for each objective, you likely have another 3 to 5 objectives that support those objectives. 3 to 5 activities that support those objectives that are tracked more regularly, like monthly or quarterly. Here's an example of an evaluation framework for one priority area with the elements we just discussed. A high-level aspirational goal, measurable objectives indicating baseline and targets, types of strategies to include, activities to be tracked, and your reporting structure indicating responsible parties and how data will be collected. Having this type of framework will also help you move forward in tracking your activities and objectives, which Anne will talk more about later. Let's talk a bit about setting SMART objectives. I'm going to guess that most folks on this call have heard of SMART objectives, or objectives that are specific, measurable, achievable, relevant, and time-bound. At the top of this slide, we're showing an example of a typical layout of a SMART objective. We, of course, do recommend using the SMART objective approach when setting up your performance measures. There's also a couple of new parts of this acronym that we think is important, especially considering the work that we do, and those are inclusion and equity. The addition of inclusion pushes us to engage traditionally excluded groups in our process, while equity pushes us to consider how the objective will move us towards equity. Let's get into some examples and how you might incorporate some of the elements we just discussed. Here's an example related to obesity, which is a common priority for our clients. The goal stated is taken from Healthy People 2030. It's at the community level and feels quite lofty. There's no time frame or target stated. Our objective has a time frame and calls out cities that we want to focus on in order to address some disparities we found in our assessment. Please note that if you do this, it's really important to work with community members and partners to make sure that this is framed in a way that's appropriate and respectful. Also, especially if you're addressing a health inequity or disparity, consider how you'll ensure that solutions are inclusive of communities who are impacted. For instance, in this example, activities to support our objectives include empowering resident leaders and working with them to increase school wellness policies in higher risk cities. The objectives and strategies, of course, would only work if they were developed alongside community partners in these cities. Here's another example of a priority for many of our clients, behavioral health. Note here that the highest level is labeled priority area rather than goal, and the lowest level is labeled strategies versus activities. We wanted to acknowledge that different communities sometimes use different terminology. While we showed our ideal evaluation framework, we like to meet clients where they are. So we don't want to be overly prescriptive with the terminology here. Use what works and makes the most sense for your community. The aim is to make sure your plan has a sound logic model and measurable short and long-term objectives so that you have clear direction for implementing and tracking your plan. So moving on, another factor shown here is considering current trends when setting targets. The objective shown here is an example of how you might set a target to stabilize a rate rather than reduce it. If you find that you're doing better than expected in a year, you can and should, of course, always adjust your target to reflect those changes. Finally, this example is showing a tiered approach with activities happening each year, as well as a range of strategies for individual and system level improvements. These are all things that you can consider working into your plan. Finally, we hear a lot from our clients concerns or questions about how to incorporate health equity into their performance measures. I think a key concern is wanting to acknowledge that this is an important part of our work, but also wanting to be realistic about what can be done in a 3 to 5 year plan. We've seen our clients do this in a few different ways. Some communities use health equity as a lens that informs their indicators and targets for their plan. Some might use a framework similar to the one we showed that helps them consider social inequities and living conditions in their planning. For others, it might be part of their vision statement, and some will have it as a goal or priority area. We're not pushing any recommendations here, but just want to acknowledge that there's many different ways that communities are approaching this work, and that's okay. One thing we've heard asked is, how do you measure your impact? We'd recommend that if this is something you'd like to do, in addition to tracking some of those community level indicators we showed earlier, consider what's attainable for your current partners with your current resources. That might mean that some of your initial performance measures around health equity will be relatively short term. So here are some examples. Tracking the number of non-health agencies such as housing and transportation that are participating in your partnership or process, or the number of hospitals that have signed on to a health equity pledge. Another example is the number of programs that are conducting a social needs screening. These may feel like small wins, but over time you can build on them to build momentum for the long term. I'm going to now hand this off to Anne, who will be talking about how to take this to the next step by tracking and sharing your progress.
Thank you, Jane. As Jane mentioned, I'm going to be walking us through the next big piece of this assessment work, which is around tracking and sharing your progress. So we know that tracking and sharing progress is often where partners lose steam, but we really feel it is the most crucial step in your community health planning work. Tracking and sharing progress builds trust, it ensures transparency, and shows accountability for your plan. To help ease the burden of tracking and sharing progress, we really encourage a collaborative approach that involves your community partners in data collection, analysis, and reporting. This ensures that the process is more sustainable because the workload is distributed across different people and organizations. Also, sharing accountability for evaluation increases buy-in of the process. And finally, having multiple organizations involved will ensure broader impact of your strategies. Jane discussed the importance of building an evaluation framework that includes identified goals, objectives, activities, and responsible parties. As you're creating your plan for data collection and analysis, these are some questions you may be asking. Which individuals or organizations will be involved? What metrics are you tracking? Will they include only quantitative data, so just numbers, or qualitative data? Finally, how will you be managing data collection? Will you be using a template for a report or some type of software solution? And what is the interval for data entry or reporting? There are many ways to effectively collect data and track your plan. You can use spreadsheets, Excel documents, or you can use an online strategy tracking tool if it is available to you. This example here of a document that allows you to track some of the things we just talked about, so including the prioritized need and goal, the action plan, including objectives, strategies, activities, and responsible parties, and progress on outputs and outcomes. While this includes a lot of important information, we've heard from clients that this can feel a little overwhelming, especially if only one person is responsible for collecting and tracking this information. So as I've mentioned, this is why we really do encourage you to get broader participation in data entry and collection from the beginning. One option to help ease data collection, analysis, and reporting is to utilize a strategy tracking software. If you do decide to go this route, here are some of the things we'd recommend you look out for. The ability for individuals to enter data across organizations, assignment of clear owners and contributors for activities, ability to generate templated or customized reports to meet your needs, the ability to manage multiple plans in one place, and finally, ability to communicate progress on your plan to the public. I'll be showing some examples of these features in our strategy tracking platform, which is in partnership with Invisio. We understand that you may not currently have a platform, but we thought this might provide some inspiration. So we love that when you utilize a tool like this, it enables you to better organize, visualize, and build your plan. Here we're looking at one way to view an objective in our plan. This actually mirrors the behavioral health example that Jane showed earlier. As you can see, this type of view allows you to quickly understand the elements of your plan from priority area to objectives and strategies. You can easily scroll through to see the strategies and objectives in other priority areas as well. You might also be seeing the small photo in the bottom left corner of each box. Those are the assigned owners for each element of the plan. We like that those are clear and easily identifiable. So now that you've put your plan into action and have started data collection, you will want to be able to report out on your progress. What we have found is that different people need or require different reports at varying intervals. So that could be monthly, quarterly, or annually. For example, you might need to report to executive leadership, a board, or a director who really needs to see a high-level overview of your progress. They may need a report every 6 months or annually. Then you may have a program manager who needs to see more details about what's been completed and what the progress is. This type of person may need to be updated more regularly, possibly monthly. Funding partners may need quarterly reports to see outputs and outcomes or grant deliverables. Finally, many of our clients have expressed the need to have a publicly facing dashboard that allows community members and partners to track and see real-time progress for key outcomes. So here's an example of a report you might pull for an executive. This report provides a high-level overview of progress, including, as you can see at the top, a summary of the number of priority areas, objectives, and strategies in the plan, the status of the plan, including where the projects are on track or have been completed, or if there may be some type of disruption, and a summary of progress on the overall plan in each priority area. The nice thing about a report like this when using an online system is that it can be pulled on demand. We've all been there when we've been asked to pull a report quickly, so being able to create a report at the click of a button can save a lot of anxiety in those moments. Here's an example of another report that maybe a program manager may find useful. This report allows the manager to track the status of each project by showing clear owners and contributors, progress and status of each strategy, objective, and priority area, details of the last update entered, as well as the date of entry, and the expected end date for each strategy. Of course, there may be other reporting elements that you'll want to include. So if you are considering using a software solution, we recommend a platform such as this that really allows you to easily customize your generated reports. We also like a tool like this that will ensure better quality and consistency of your reporting. The last type of reporting that I mentioned that you may be considering is providing high-level progress updates that are visible to community members. So this ensures accountability and transparency of the plan, which we mentioned earlier, are really crucial to the success of your efforts. So here's an example of a public-facing dashboard that shows progress of activities in your plan alongside those community-level indicators there at the top. In addition to high-level summary of progress, your public dashboard should also include tracking of key metrics. For example, here we're showing a detailed view tracking monthly referrals to a suicide prevention hotline, which was a metric for our behavioral health priority. Just a note here that many of our clients need to track both qualitative and quantitative data. This is especially true for emerging areas such as health equity, where performance measures may be more difficult to define. In this example, you can see an update about the suicide hotline alongside the quantitative data. So whether you're reporting this on paper or through a software system, this will likely be an important feature of your reporting. Finally, we want to acknowledge that many of you are likely using a collective impact approach for your work. Having a system for tracking and sharing progress reinforces this approach by allowing you and your partners to contribute data through shared measurement systems, track mutually reinforcing activities, and create an infrastructure for reporting and accountability. We want to applaud you for looking for ways to meaningfully track your impact, we know this process can feel quite daunting. We encourage you to really take a long-term perspective. We found that it does take time for communities to learn from their progress, and each cycle really does build on itself. So know that you're rarely starting from scratch. Over time, your learnings will move you towards long-term change and improvement. But if you're still feeling like you need expert guidance, please don't hesitate to reach out to us. So that concludes our presentation and will lead us to the discussion portion of the webinar. Please feel free to ask any questions in the Q&A and send to all panelists. For this part of the webinar, Jane, Ashley, and I are going to turn our cameras back on. We introduced Ashley in the beginning, and some of you may remember her from the first part of our webinar series, but she's here to help answer any questions that may have come in. So Zach, can you share any questions that we may have?
Thanks, Anne. Yeah, there's definitely been some questions coming in. This one is asking, how long does the planning process usually take?
Hey, I'll take that one, Zach. Thanks. From our experience, we really see that planning for evaluation and tracking, whether for your implementation strategy or your community health implementation plan, should really be a continuous process from one assessment cycle to the other, so that you begin to create this iterative learning process, so you're not starting from scratch every time. And I think you'll find that your evaluation results from one cycle to the other will feed into the planning and implementation portion of your following CHNA or CHA cycle, and that will result in their own tracking and evaluation. So hopefully over time, you're evolving your process each time and streamlining and strengthening it as you go, because it is really a learning process, and hopefully we're getting better each time we do it. And I think, as Anne and Jane mentioned, working with community partners throughout this process, we like to build in components for tracking and evaluation when we start the assessment process, work to review their previous assessments and reports, as well as their implementation strategies or improvement plans. And that allows us to identify where progress has been made over time from their previous cycle, where we may be able to build on areas and identify other points for strengthening or improving for the next process. Jane, Anne, I don't know if either of you would add anything to that one.
No, I think that was a good summary of that cycle. I really appreciate. I think I'd gone through 3 or 4 cycles over in Orange County, and I really want to emphasize that iterative learning process. I think we always described it as sausage making. It's always difficult, but it tastes good at the end, and you do really learn each time as you're going through that.
I think people have often just at the very beginning, at least when they did their first assessments, trying to throw everything as much as possible into their strategies, and it just became overwhelming to implement and overwhelming to track. And so a lot of the work that we do is just trying to narrow that down, narrow the focus, being more meaningful in not only what you're implementing but what you're tracking, and then grow as you're ready to grow.
Thanks, Ashley, for that detailed answer, and for us, the team, for sharing your thoughts on that. So this next question, Ashley might be able to answer as well. Someone's asking, how do you gain buy-in for implementation and data collection?
Trying to manage my mute and unmute, and it's really difficult, apparently. I think that this is something else that we've touched on throughout our webinar series, and that Jane and Anne both talked about today, about the importance of getting buy-in really from the beginning, reaching out to community partners, reaching out to stakeholders, and it's really a crucial step to start that solid foundation. And by bringing in these partners and stakeholders, bringing them to the table at the planning process, whether you're a formal collaborative or not, it allows you to ensure that everyone's needs are being discussed and considered, You can build synergy around the process and gain that buy-in and ensure that everyone is benefiting from that process and everyone has a voice that's included. I think it's also important to include your community partners in the data collection phase as well, especially when collecting community feedback. If it's qualitative data collection like focus groups or key informants, as well as implementing community surveys. This ensures that you're integrating that community voice, having them at the table for prioritizing the health needs is another important step in that process. And as you move on and begin developing your implementation or improvement strategies. I think it's also to think about your shared goals as you're setting that tracking document up. What work is already being accomplished by you and your partners in the prioritized health areas, and what data is already being collected and tracked, because there's really no reason to duplicate it if it's already out there. And if you need more formal data sharing or data use agreements, I think it's always better to start those earlier than not, because if you know, the lawyers have to get involved, you have to work through those processes, it can take a lot longer. And as I previously shared and we emphasized, this is going to be a learning process and you'll grow and get better each time you do this. And I think this includes strengthening that community partnership and getting that buy-in.
Thanks, Ashley. All really great considerations. And this one might be a good question for you to answer as it relates to the tracking software that you showed earlier. If someone works with a bunch of different people from other organizations, does that tracking software that you showed allow other people to enter their own data?
Yeah, that's a great question. That's the case with many of our clients. They are working with other organizations. So yes, the tool does allow you to add unlimited individuals or partners to access the system and input data and provide updates. It also allows those people to create reports and dashboards. What's also great too is that if there is an individual that doesn't need access to the system, so say a board member or someone, you can actually still create reports that can be automatically sent to that person's email on a recurring basis, so they don't actually have to log in if they don't need to. And you know, something we didn't mention in the presentation is that this tool also allows you to create automated reminders for owners and contributors. So they will receive emails to remind them to go in and provide updates on the work that they're involved in. That answers the question. Jane, Ashley, I don't know if you guys have anything to add.
Doesn't look like it from the head shaking. Thank you, Anne. So this next question, how does my group ensure that we're taking health equity into account when we're designing and implementing our strategy evaluations?
I'll jump in here to start, but I think Jane included a lot of great ideas and examples in her slides today. But I really think we should aspire to build in health equity and that health equity lens into our assessment and planning and implementation phases, as well as when we begin tracking and evaluating these components. I think how we build our data collection tools, if we're putting our surveys together or our facilitation guides for focus groups, for example, the questions that we're asking, how we ask the questions, who's asking those questions, and how we're incorporating those community voices are important, as well as the secondary data that we're adding in, because all this will contribute to the outcomes of our assessments and influence ultimately what we're tracking and implementing. And as Jane mentioned, I think how we analyze our data is important as well. Are we able to look at data by breaking it down by different age groups or different socioeconomic statuses, or by race and ethnicity? And I think that allows us to dive deeper into our data and have a more robust consideration for our program implementation. Jane, what else would you add?
Yeah, all of those things. And I was thinking back on, you know, the slide I had both about making sure to have a framework. We really like, you know, HCI has really taken a look at that BAR High framework, the Bay Area Regional Health Inequities Initiative framework. to guide some of our work. And something like that, I think, provides good examples, again, of indicators and strategies that you might be considering. Some other things, I talked about the different ways we've seen our clients and community partners incorporate health equity. I should have said, not just that there's no one right way, but you don't have to just do one way, right? Like you could really have a health equity lens, you can have a vision statement and a goal and performance measures and data collection that all include those elements that Ashley was talking about. And I'd say the most important maybe thing is just that inclusion piece of it. I think oftentimes when we're working in our partnerships, we don't stop to take a look around the table and ask ourselves, is everybody here? And I've heard other partners say sometimes that's the question they ask is who's missing at this table, who needs to be invited, who's not here. And that question is really important for just making sure the overall process has that inclusive lens and that health equity lens.
And Jane, I think you can always ask that question, like ask it this cycle and bring more people to the table and then keep asking that one. So you're bringing fresh faces and fresh voices into the process as you go, because it's always, good to bring more people in.
Absolutely.
Thanks so much for sharing your thoughts on that, guys. And I'm loving the variety of all of these questions that are coming in. So thank you to our attendees for being so active and engaging in our Q&A box. This next one is coming in from someone who's wondering if my agency doesn't have the capacity to create a dashboard and improvements are new to us. This is going back to that dashboard that you were showing, and does Conduent offer that, or is it through a vendor?
Yeah, we do offer that. That's something that we can work on with you. I'm assuming you're referring to the strategy tracking software. So yes, it is something that we can absolutely help you with. That email address that's on there, please feel free to use that and send us an email. We can chat further. If you are referring to the dashboards that Jane was showing with some of those community level indicators, that's also something that we work with communities on to help them build out more local websites with local data. So if that's of interest as well, please feel free to let us know.
Thanks, Anne.
Yeah.
And Jane, I think you might be able to answer this one. Do you have any advice on how to structure the CHIP, the Community Health Improvement Plan, to keep active involvement from partners?
Yeah, that's a great question. And I think this is kind of the theme that we've been having around collaboration. I think the first part is just making sure that there's involvement and collaboration from the beginning. So really starting from your assessment process, so everyone's agreeing on the priorities that are selected, having regular communication. So when I was kind of in charge of this process, I would not let a lot of time go by before I was, as the coordinator, reaching out to folks. I think infrastructure, well, that's one of the elements Anne talked about in that collective impact approach, right, is having a backbone support organization that's kind of guiding that effort. I think that's really important. So having the infrastructure to make sure that communication is happening, reporting is happening, and spreading the ownership of all of those activities. So one person might be coordinating things, but you're making sure to include all of your partners in the data collection and the reporting. All of that is just key to keeping things moving. The other thing we mentioned is sharing back results. I think that's something that also often gets missed, especially if you're the coordinating person or organization. You kind of have all of the information, so sometimes you think everybody knows, but they don't. So I love the public dashboard because it does just that. Is people can on their own check in when they need to get the information they need for the planning process. So those are just some of the tips that we have. But again, as Anne mentioned, I know we're running short on time, but please feel free to reach out to us on the email address that's provided. And Ashley, I don't know if you have anything to add to that.
No, I think you covered it well, Jane. Thanks.
Alrighty, well, it looks like we are just about out of time. We of course want to be conscientious of everyone's busy schedules. So thank you again to our presenters for the great discussion, all of your input, and all the great content that you've presented. We've put our main contact email on the slide here if you have any questions about how we may be able to support you and your organization. And of course, for our current clients in attendance, definitely feel free to reach out to your account manager or project manager if you have any questions following today's webinar. And just thank you again for our attendees for joining us today. And that concludes today's presentation.